If you have a retinal detachment, when is it hopeless? Let's talk about it. Hi, my name is Zach Oki. I'm a retina specialist here in Irvine, California. The question here is about a specific kind of retinal detachment, what we call a macula off retinal detachment. You see, when we talk about retinal detachments, we're often very careful about describing their anatomy, because if someone has a macula off detachment, that is, the macula, the center of the retina, has been involved, and someone is legally blind in that eye, then we don't really rush too much, but we want to fix it quickly. Whereas if someone has a macula on retinal detachment, that is, the macula has not yet been involved in the retinal detachment, we usually work really quickly. We want to fix that, let's say, within 12 or so hours. With respect to a macula off retinal detachment, there definitely are differences in terms of timing. If we just look at 1 week after the macula has been detached, we know that there's a difference between the first part of the week, let's say the first 3 days, and the end of the week. That is, if we just study 1 whole week. So this is why, even though if someone has a macula off detachment in my clinic, I say, well, we don't necessarily need to do surgery today, but let's find a time in the operating room tomorrow or the next day, because we know the outcome will be better as compared with waiting, let's say, until the end of the week. As for further from that, let's say a week, longer than a week, the outcomes are all over the board. In other words, I'm never the kind of guy to say, oh, it's hopeless. I had a patient who was actually a doctor who was on vacation with his family. His left eye went totally blind, and he thought, yeah, this is probably a retinal detachment. But he kind of sat on it, and he came to my clinic 6 months later. We did a surgery for him. He developed a little bit of scar tissue. We had to repeat the surgery, not because the retina redetached, but because the scar tissue was kind of mangling and distorting his retina. But in the final analysis, he was 20/80. He couldn't see an eye chart, but then at the end of it, he was 20/80. And this was, by the way, after cataract surgery. I'm not suggesting that these anecdotes should drive every medical decision we make. We have to make a systematic analysis when we speak in general terms, but I guess what I'm trying to suggest is, if I've seen specific kinds of experiences, just me personally, then I never lose hope. Maybe I'm like a hopeless romantic or an eternal optimist or something, but if someone's retina's detached and someone says it's been here for a year or 6 months or whatever, I still offer them surgery, because I don't know where we're going to go. They could end up legally blind in the outcome in that eye, but if they don't, if the vision gets better, if we're able to prevent other issues from a chronic detachment, like the eye looking weird, then I'd say it's worth our effort. So is it ever hopeless? Yeah, sure, it could be hopeless in certain circumstances, but I don't know that ahead of time, so that's why I always